Hi, everybody. I'm Dr. Eleanor Stein. Welcome to my video tip of the month for January 2025. I'm celebrating the new year with a hopeful topic. The question, can people with complex chronic diseases recover? Now, this is a very controversial question, so much so that often when someone with ME or another complex chronic disease, like long COVID, reports substantive or full recovery, not only their diagnosis, but sometimes their personal integrity are brought into question. The doubts usually come from a focus on a conventional understanding of how biomedical and biochemical aspects of disease work. There are many aspects of disease for which we don't have good solutions. Here's what I mean. Imagine that you've had many test results over the years showing that you have genetic variants that put you at high risk for disease. Maybe you've had high levels of toxins found in your body, multiple chronic infections, mast cell activation markers, a history of chronic mold exposure, things like small bowel bacterial overgrowth, hypermobility, autonomic dysfunction, immune dysfunction, and so on. This is not an unusual situation. You would be forgiven for thinking that the severity, longevity, and complexity of your disorders are just too great for recovery to be possible. And you might think that if recovery were to be possible, it would require some outside intervention from some newly discovered medication or procedure. And unfortunately, given the glacially slow pace of medical research, you may have lost hope that recovery may be possible within your lifetime. And yet, increasing numbers of people are reporting significant improvements. So how can we explain this? Maybe we can learn something from people who have recovered. But let's not start with complex chronic diseases, which are so controversial. Let's start with cancer, a condition whose biomedical credentials are impeccable. Cancer diagnoses are based on slides, right? Pathological slides taken from the cancer, which, although not perfect, are much harder to quibble with than the clinical diagnoses used to figure out if someone has ME or FM or environmental sensitivities. So would you be surprised to learn that actually many people with what is called terminal or end-stage cancer actually recover? Psychologist Dr. Kelly Turner got interested in this. She noticed that when people with so-called terminal cancer recover, they often experience an alarming lack of curiosity from their healthcare team, even when they outlive their prognosis by many years. So Dr. Turner made it her mission to figure out what survivors attributed their remissions to. Her curiosity turned into a PhD thesis. This turned into a couple of books, a docuseries, and now into a worldwide movement. You can learn more about Dr. Turner's work at the website radicalremission.com. In in-depth interviews with over 1,500 cancer survivors, Dr. Turner found some common themes. Now, not all of these are going to be suitable or applicable to you, an individual with a complex chronic disease, but there's a lot of wisdom in this list. What I found interesting is that the list of strategies are all accessible self-management strategies for which you don't need a prescription, a healthcare professional, or a lot of money. So here are the 9 that made the top list. Number 1, these people became proactive in the decision-making about their treatments, including lifestyle changes, which ones to make, which ones to let go. They listened to their gut instinct to guide their choices, even when they had people telling them to go in a different direction. They had strong reasons for living. Maybe they were a young parent with a child. Maybe they had a relative or a loved one that they wanted to help or be with. So they found a reason for living that motivated them to make the often difficult changes they felt they needed to make to be able to survive. Many people radically changed their diet, eliminating processed food, sugar. Many of them went vegetarian and emphasized whole plant-based eating. Many incorporated natural strategies like supplements to strengthen their immune system and their overall health. Many, if not most, made a priority to cultivate joy, gratitude, and love. Many let go of deep-seated anger, resentment, and trauma, either through work themselves or working with a mental health care professional. Many decided to quit work or other commitments that were taking up a lot of their time and use that time to prioritize connection with family, friends, and community. And lastly, many people focused on their spiritual connection through prayer, meditation, and other ways of connecting with a higher power. I love Dr. Turner's two books, Radical Remission and Radical Hope. For me, they were page turners. I couldn't put them down. I've recommended them to many people, mostly people with cancer over the years, and they've universally resonated with the hopeful, empowering messages. So you might be thinking, okay, that's all well and good for cancer, but maybe there's something unique about myalgic encephalomyelitis and other complex chronic diseases that makes recovery even more difficult. While that may be true, the reality that I'm noticing is that just as with cancer, an increasing number of people with ME and related diseases are reporting improvements and even full recovery. I recently talked with Podcoast host Raylan Agel. She's interviewed more than 200 people who claim substantive, if not full recovery. And she's also constructed a list of the things that they have most commonly told her. I'm going to share some of them with you now, and you may notice that her list overlaps considerably with that of Dr. Turner. I've divided Raylan's strategies or messages into three categories. The first one is she found that most people recovering had put quite a bit of focus on supporting their body's basic needs. So things like getting enough sunlight, hydration, sleep, and implementing a healthy diet. Many of them focused on ways to manage their stress, and their ways were very unique to each of them. Many people focused on renewing connection and enhancing joy and love of life. Second category has to do with the autonomic nervous system. So they found a way to understand that not all physical symptoms are a sign of danger, that not all physical symptoms are a sign of structural damage. They came to understand, if they hadn't already, that emotions affect physical symptoms, and resolving strong emotions can help healing. They developed a hopeful mindset, including having a belief that recovery is possible. This enabled them to make things that might enhance recovery a priority. They accepted their current circumstances and they practiced self-compassion. As I think about this topic and read and listen to the experts, I've come up with 6 tips for recovery. Number 1, we are all different. So no matter how much research you do, your path to improvement will be unique. So do as much research as you feel you need to do, but then rely on your intuition for direction. Do what you think is right for you and not necessarily what others tell you. It's a bit of a truism, I guess you would say, that you can't get better doing the same things that you were doing when you got sick. So to heal, you have to be willing to make some big changes, such as the ones that Dr. Turner and Raylan Eagle have reported. So spend some time considering what changes you feel able and willing to make, and then put them into action. Number 3, the mind and the body are intimately connected to each other and intimately connected to healing. Be open to a wide range of strategies. You don't know until you try them which strategies might be the game changers for you. You need to believe that recovery is possible. This will motivate you and keep you open to the things you need to do to allow your body to heal. Now, this part is a little bit woo-woo, but I believe healing is more likely if your thoughts are coherent with your health and life goals. The evidence is there. It's research-based that the mind and the body are one. The mind affects the body in measurable evidence-based ways. Number 5, listen to accounts of people who have recovered. Find especially people with whom you can personally relate. And then if it feels right to you, consider trying some of the things that they did. Finally, join a solution-focused community. Learn from others who are on the path and get support from them. An example is my Live with Dr. Stein community. Check the links below for more information. Start somewhere, anywhere. It really doesn't matter. We are all so different. Take baby steps and share your successes to pay it forward. If you want to read more about this topic, including my hypothesis about how biology may hold an important key for healing, click on the link below to go to my blog page. Happy New Year and happy healing.